Hello, Dr. Steebblock. Kindly tell us, where did you study medicine, and after the medical school, your journey till today, how was it?
Well, I'm a citizen of the United States. I was born and raised in the middle of the country in a state called Iowa. And I was the oldest boy of 5 children. And because of that, I was put in charge of operating the farm at a very early age. I started operating a tractor when I was 5, and by the time I was 6 and 7, I was working 8 hours a day in the field, working in a tractor and running the farm and telling my brothers and sisters what to do. And from there, I graduated from high school and then went to Iowa State University in Ames, Iowa, where I graduated with a bachelor's degree in zoology and chemistry. And then I went on to the College of Osteopathic Medicine, Des Moines University in Iowa. And there I obtained a master's degree in biochemistry and my doctor of medicine, or doctor of osteopathy, in 1970. And then I practiced in a rural logging town in Forks, Washington, where I took care of 5,000 people. I had a 32-bed hospital, and I was a solo practitioner for a year or two. And then I went back to training and did a residency at Case Western Reserve in Cleveland, Ohio for 3 years, and then 1 more year of residency at the University of Oregon in Portland. And from there, I moved to Lake Forest, California, which is just up the road, and opened up my practice. And I formed the first holistic medical clinic west of the Mississippi. I started taking care of people that no one else could help. All the other doctors had failed with. And so my practice has been, for the last 40 years, patients that were untreatable or undiagnosable and unmanageable by the standard care that was provided by the doctors that we have in this country. So most of my patients have already gone through Scripps, have already gone through the Mayo Clinic, and have already gone through MD Anderson or whatever, and have seen 20, 30 doctors and have not had responses. And so my job has been to really dig up answers from around the world. I have sought out answers from every country in the world, every smart doctor, every patient that ever had a disease. I've been trying to collect all the information possible so I could help the next person. So I specialize in chronic degenerative diseases. And these diseases include things like amyotrophic lateral sclerosis, multiple sclerosis, Parkinson's disease, stroke, acute and chronic stroke, congestive heart failure, coronary artery disease, atherosclerosis, ulcerative colitis, Crohn's disease, and on and on. There's many genetic disorders that I work with too. I have been doing, I first did my first bone marrow treatment and test in 1968. I worked with Donnell Thomas at the University of Washington in Seattle in 1963. He won the Nobel Prize in medicine for his work on bone marrow transplants. And then in 2000, back up in 1990, I started to specialize in neurological rehabilitation using hyperbaric oxygen. And I was the first person in the world to do hyperbaric oxygen for stroke rehabilitation in a comprehensive stroke center. And then in 2001, I started to become knowledgeable about the use of stem cells, started to treat patients with stem cells, and by 2003 decided to specialize pretty much entirely in the use of stem cells. By 2006, I was doing bone marrows and bone marrow transplants, and by now I've done well over 3,000 bone marrow transplants for treatment of chronic diseases. I've done over 7,000 patients with umbilical cord stem cells for treatment. And so as far as I know, I've done more stem cell therapy as a single doctor than any person in the world.
Can you tell us why the patients are coming back to your clinic, the last resort? So what is the reason?
Well, I would say success. For example, just 3 weeks ago, amyotrophic lateral sclerosis is an incurable disease no one has the answer for. I determined what the cause is of amyotrophic lateral sclerosis, and you can read or hear about it on YouTube if you want. But my name's Steebblock and amyotrophic lateral sclerosis in YouTube, and you'll get videos of me describing what the cause of this condition is, and knowing the cause allows you to treat it much more effectively. These causes are not known by virtually any other doctors, and so that's a kind of just as an example of one case, one kind of disease that I have developed a rational thought process as to what causes it and then how to go about treating it. And basically in that disease, as well as other neurological conditions, most of these cases are due to toxins, and the toxins are caused by intestinal tract poisons. These are bacteria, yeast, and the combination of these things, there are different bacteria and yeast that have a variety of toxins. Clostridia, for example, is a neurotoxin that causes over 100 poisons that can enter into the body and poison the brain. Yeast has over 70 different toxins that poison the brain and causes inflammation of the body and the immune system. And so these are poisons that need to be addressed. Virtually no other doctors even think about the fact that the intestinal tract is a source of poisons that's contributing to the cause of these conditions. So I make sure that we examine these different poisons, try to eliminate them as much as possible, and try to eliminate them from damaging the brain. Once we've done that and cleaned up the body, I believe that the body has to be as pure as the day it was born to have optimum rehabilitation and regeneration of tissues. If you have if you have a field, as a farm boy, I can tell you, as a farmer, you don't grow good crops in a land or ground that is full of garbage. So you don't take your garbage from your house and spread it out, tin cans and debris, and put it into your soil and think that you're going to grow good crops. You have to have your soil, your ground, as clean as possible. It has to be fertilized properly, and it has to be given good seeds. Stem cells are the seeds, but your body is the ground. If your body is full of debris and tin cans, if you will, and just all the junk that is present from your intestinal tract and from the food that you eat, the hydrocarbons, the pesticides that you've breathed in, the poisons that you've gotten in from your body from breathing, all of these things accumulate in your system over the years. Metals, heavy metals like fish has mercury in it, tuna has mercury. Mercury poisons your body, poisons the nervous system, and poisons the intestinal tract. All of these things contribute to the cause of these conditions. So you have to really identify all of these things as fast and as much as possible, clean them up, and then when you're clean, then you give the seeds, and then you have success. Now, when people come from the Middle East, they have to come and spend some time because it takes time to clean these different things, and the doctors there in the Middle East don't know how to do this, and they psychologically, they just are not prepared. Medical doctors are trained for drugs. They're never trained in nutrition, or very seldom do they get any training in nutrition. They get very seldom any training in toxicology, and they're trained in the use of drugs. And drugs, unfortunately, do not take away toxins. They actually can oftentimes give you toxins. So giving you a drug sometimes can give you short-term benefits, but in the long term cannot repair and regenerate your brain, or regenerate your heart or your kidneys or whatnot. So my practice is one of identifying the toxins, cleansing your body of the toxins, and then putting the very best seeds back into your body and helping your body grow these seeds back into good, healthy tissues like your brain, like your heart, your kidneys, so that you have basically new heart tissues, new brain tissues, new joint tissues, so that your joints can be repaired, your heart can be repaired, your brain can be repaired, and your kidneys can be repaired by these techniques that I have developed. And my clinic is designed to do all of that. So I have a large clinic, a large library, and a research staff that we all work together, and I have doctors all over the world that I can pick from. I have access to well over 1 million scientific papers that I personally have selected through the years on these different conditions, and here are pictures of my library that you can see the vast quantities of papers that I have collected that I use to help people when I need to. I have over 50,000 books in my personal library, and over 30,000 electronic books that I have access to, and 20 million papers online on the computer that I have access to. So I have just a tremendous amount of information that I can bring to bear if I need to be able to solve your problems. Now, with all my experience, oftentimes I can do it without all that, but in those cases where you've seen 10 or 20 or 30 doctors and you've gone to the best doctors in the world and you have not got the answers, then I'm here to help you get these answers.
You mentioned hyperbaric treatment and you mentioned bone marrow, but we know that you have state-of-the-art modern treatments that you are applying in the clinic, like laser treatment and other treatments that you have, very new treatments. Can you talk about them a little bit, please?
Well, sure. The fact is that I specialize in stem cells, and so everything that I have in my clinic is designed around helping the stem cells work better in your system. So, for example, you mentioned lasers. We use lasers, we use infrared, we use pulse magnetic therapy, we use hydrogen therapy, we use ozone therapy, we use vitamin therapy, we use growth hormones like Neupogen, human growth hormone, progesterone, dehydroepiandrosterone, a lot of different things, all of which contribute to enhancing your body's ability to make these stem cells grow and help your stem cells turn into these new tissues. And hyperbaric oxygen is one of those that helps with this whole process, and how it works and why it works, and all the mechanisms of how these things work is somewhat complicated, but in essence, you're making new tissues. And new tissues need new blood vessels, and so new blood vessels are made by the stem cells. For example, if you have macular degeneration, the eye is dependent upon the macula, which is the back of the eye, which is what you're looking at and using right now as you're looking at this, at my face. Your macula is looking at my finger, and that macula is the part of your body that is using more oxygen than any other part of your body. And if that part of your body starts to suffer from a lack of oxygen, you start to suffer from a poor eyesight, and that is called macular degeneration. So when your eyesight starts to diminish because of macular degeneration, it's because of poor eyesight, poor blood vessels, and this is caused by lack of oxygen. The lack of oxygen occurs while you're sleeping, and the doctors that you've been dealing with have not even thought about testing you for a lack of oxygen while you're sleeping. That test is called a nocturnal oximetry test, and almost everybody with chronic degenerative disorders should have that test done, because if you have a chronic intermittent episodes at night of a lack of oxygen, this causes your whole body to become damaged, because every night as you're having this hypoxia or lack of oxygen, the body is being told, we need to make new blood vessels throughout your body. And so your body starts to try to make these new blood vessels, but then the oxygen level starts to come back up to normal during the day, and those blood vessels are no longer being told to grow. And so you have this intermittent burst of growth factors day after day after day, and so the capillaries start to grow, die back, start to grow, die back, which causes fragile blood vessels, and they start to degenerate, and you start having weeping, bleeding blood vessels in your eye. And so macular degeneration is due to this intermittent oxygen deprivation. And so what we have to do is make sure that your whole body is clean, first of all, no mercury, no heavy metals, make sure that you have adequate oxygen, and then give you stem cells, because the stem cells make new blood vessels, because the stem cells produce growth factors on a daily, 24-hour-a-day basis, so you get new healthy blood vessels. And so once you do this, then you can see better, and your eyesight can return to normal, and that effect can last you then for years and years and years. Whereas the shots in the eye, they don't do anything other than kill those blood vessels that are trying to form. Your body's trying to form these new blood vessels, but they're not forming correctly because of this intermittent oxygen deficiency that you are having at night. And that occurs because you're overweight, you're older, you drink, or for other reasons, this occurs. And if you don't, and you as a person cannot identify that because you're sleeping. So you have to have a test. That test is a nocturnal oximetry test, simple test. Little clamp goes on your finger to a little machine, push the button, wake up in the morning, give it to the doctor, he tests you, and that can be done in the Middle East as well, or any place else. And yet most doctors don't even think about doing that for anybody, so you have to tell them to do this. Nocturnal oximetry, very important test to start off if you're going to have a return of function of whatever's wrong with you.
As you explained, you challenge and you treat very difficult cases that the others, even they don't want to touch. Can you mention today what is your specialization and what are the major conditions that you want to treat?
Well, I've been specializing in neurological disorders, like I said, stroke. I've treated thousands, literally thousands of patients with stroke. We have about a 95% success rate in terms of improvement, not a cure, improvement. I don't care what treatment you've gone through. If you haven't gone through stem cells, you can still, in general, see significant improvement with your problem. So stroke, I would say. Cerebral palsy is absolutely fantastic. Stem cells are just the best treatment for cerebral palsy that there is. Autism, very good as well. Parkinson's, very good results. Progressive supranuclear palsy, multiple sclerosis. Oftentimes you can put people into remission with that. Alzheimer's, you have, especially if it's vascular dementia, you can have very good results with that. Congestive heart failure, absolutely superb. What else? Joint problems. Within 2 or 3 weeks, your pains in your joints are gone. You're able to walk and function and go running again, function again. You can't just get a shot, though, and go back to running the next day because it takes time for all these things to function and grow. Stem cells are, like I say, seeds. You put them in the body and they start to heal, but it takes time. It can take 3 to 6 months for that new tissue to grow. So you have to be patient that this is a long. You have short-term results. I have people within hours getting better, but also people 3 or 4, 5, 6 months out starting to see improvement. So you have to understand this is a process, and it's not something that's just absolutely miraculous within 24 hours. Now, sometimes it can be. We had a patient here just 2 days ago with vascular dementia, and when I put the needle into her back, into the cerebrospinal fluid, and gave her stem cells, within literally 5 minutes, she was saying, I can't believe it, but I can think again. And she started to cry because she could think. For the first time in years, she actually could think again and remember again. So you see, once in a while, miracles like that happen, but more oftentimes it's through 2 weeks, 3 weeks, 3 months, that kind of thing, that you have to understand that it takes time for the body to repair, especially if you've had a lot of damage, tremendous damage in the brain, or if it's a nerve tract. The nerves from the brain to the foot takes 2 years for those nerves to regrow back down to the toe. So all of this is a process, and you have to make sure that you play your role, which is no longer can you drink alcohol, no longer should you be taking in poisons, no longer should you be breathing a lot of toxic materials, and you want to get plenty of rest, and don't be stressed out, and don't be riding motorcycles and bouncing yourself around and thinking that you're a young person, because these are the things that cause the stem cells to die, and infections. You don't want to get infected. So especially the first month or 2 after the treatment, you want to avoid people that have any kind of colds or pneumonia or anything, because if you have an infection when you get stem cells, or shortly after you get infections, then the stem cells will die and you don't get results. So we have a lot of really, really great things with stem cells, but we also have some problems that we have to deal with, and that is something that really I have to make sure that you understand that don't come and be, if you're an alcoholic or you have to have your bottle of wine every night, don't come. Don't come here, because it will not work. You're wasting your time and my time and your money to think that you're going to get better. It will not work. If you're going to go back to riding a motorcycle 3 days after you finish your stem cells, generally that's going to cause the stem cells to die, because extreme vibration causes the new blood vessels in the brain or in the tissues to die, and so you're just killing the new tissues that you're doing. Heavy duty stress will do the same thing. Infections will do the same. Heavy fish, like mercury-containing fish. If you eat a lot of mercury-containing fish, that will kill the stem cells. You have to be careful of all those things, but as long as you're careful of all those things and do everything right, you're going to have, in general, a very good result.
You didn't mention smoking, and I think our viewers, a lot of them smoke, and especially they smoke the hookah. So what do you advise them?
Well, if it's nicotine, it's not a problem. If it's cadmium that's from the smoke, it is a problem. Cadmium is a heavy metal that does interfere with the cigarettes, and so with the stem cells. So cigarettes and smoking cigarettes have cadmium, and so that's the only problem with smoking. You know, I had a patient who is a 2-pack-a-day smoker come in one day for treatment with a stroke. And I said the same thing. Oh, this is terrible. You cannot think that you're going to get results if you smoke 2 packs a day of cigarettes. And she says, I don't care. I'm going to keep on smoking. You're not going to get me to quit smoking. I said, well, just be aware that I can't guarantee that you're going to get results. She went through the therapy, and you know, she did spectacularly. So I would say that really quitting smoking is not essential to the program, but I would insist that you cannot come into my office and smoke in my office.
Thank you for the advice. As we understand, and you explained that bone marrow stem cells and these new treatments are the future of the medicine. And we understand that very shortly you will add a new device in your lab which will improve and give better results. Can you talk about that machine a little bit as well, please?
I really have a lot of different machines and in the laboratory, and so we're constantly improving all of what we're doing. And so one of the things is safety, and so stem cells are in general safe. The only trouble with stem cells is bacterial contamination, and so we have to make sure that bacteria from the air or from your skin or from your breath or whatever doesn't get into these stem cells before we give them. And so we have to have certain testing devices to monitor the stem cells during the time we're growing the stem cells, during the time just before we give them. So we're testing them in a variety of different ways. And so that's part of the equipment that we use to make sure that these stem cells are as effective and as sterile as possible. So I would say that would be number one type of instrument. Then the next equipment that we use are a thing called Fourier transform infrared spectrophotometry, and that's a device that can tell us, for example, any kind of a substance we can put in this device, and it'll tell us how pure it is, so we can make sure that any supplement that you're taking is correct for you. We also, by the way, are using genetic analysis for you, and we use a company called 23andMe. And after we get that, and that's something that you can order from wherever you are in the world, that only costs $100 or $200. Once we get that test, we run it through another couple databases, and that test will actually tell us what supplements you shouldn't take based on your genetics. And so there's virtually no other testing that I can do that actually tells you that you shouldn't take this vitamin as compared to that vitamin, or this supplement versus that supplement, other than through genetic testing. So personalized regenerative medicine requires very intimate knowledge of who you are and what your genetics are. So the more of that kind of data that we can get from you before you come, the better we're able to help you. So speaking about that, we do and can do genetic engineering if those kinds of situations are required. I've been doing gene therapies for about almost 8 years now, but it's a rare case that I do that. In general, what we're doing is more likely we're doing umbilical cord stem cells, and I've developed methods that so that they're very safe. You don't have any graft versus host reactions, and if you're here long enough, we can actually it's a process called induction of tolerance or stem cell education, where we give you stem cells on a daily basis, and then of the same lot, and then after we've given them to you daily for a few days, we can put them into your bone marrow, and once we put them into your bone marrow, they stay there in your system for then forever, and you have brand new umbilical cord stem cells giving you fresh growth factors and growth and brand new stem cells daily, pretty much for a number of years to come. So this is a new technique to actually help you rejuvenate your whole body if you're getting older.
Let's talk about the healthy people. We understand that recently you developed a new supplement which is called Steemgevity, and how healthy people can use and benefit from that. And we know you developed another treatment for treating the aging on the face using natural and the own body's sources. So can you talk about these two subjects, please?
Well, the facial rejuvenation with stem cells is becoming more and more popular, and so what we do is we take your blood, and we've got a new method. So if you don't want to have a needle put into your hip, we can take just a blood sample, and might be possible even to have blood sent in from outside of this country to us so that we could process these blood samples, and from the blood, from your blood, we can actually isolate and grow stem cells, and these cells then can be injected back into your face and give you like a facelift, and this gives you brand new stem cells, which helps regenerate the what's called the extracellular matrix, which is part of the tissues here. And what happens with me, like for example, I haven't had this treatment, so I happen to have a few wrinkles and my face is sagging because I'm 72 years old. And so if next time we do a video, maybe I'll have this done, and then I'll look like a 40-year-old. But you have to have tone, you have to have hydration. Part of the reason why we get older is because this extracellular matrix, which is connective tissue, elastin tissue, and what is called glycosaminoglycans, or mucopolysaccharides, these materials hydrate the skin, underneath the skin, and they are injured by free radical stress and free radicals and heavy metals. And so these free radicals, which are like biological time bombs, are constantly being formed underneath the skin, and that causes degradation of these mucopolysaccharides so that the mucopolysaccharides can no longer hold water and give you that plump, beautiful looking skin that a baby has. Now, if you were to compare a baby's skin and your skin, you would find that you have probably 10 times less mucopolysaccharides than a baby's skin. And so that plumpness, that beautiful looking skin of a baby is because of the mucopolysaccharides being able to hold this water. And these mucopolysaccharides are damaged as we get older and older by these free radicals. So by putting new stem cells in there, you have the stem cells of a newborn baby producing more of these mucopolysaccharides, which causes the hydration. So your skin starts to become younger and a little bit more fresh and really much better looking because of that. And by putting them into your hip, then you keep that kind of appearance for a lot longer than you would from a regular facelift.
Let's talk about Steemgevity as well a little bit.
Well, Steemgevity is a product that is a natural product that anybody can take basically, and I have children to older people that take it. It's a product that releases your own stem cells into your body, so you have a more enhanced regenerative effect from your own tissues. It has growth promoting factors. It has number one, in most people they feel better, they have more energy, they have less depression, so it's sort of an antidepressive, better, you feel better, aches and pains tend to go away. I have had actual people who've had strokes regain some function from their paralysis, that kind of thing. Pains in their knees, arthritis has been helped. So in general, it's a poor man's stem cell treatment that you can do at home. You can use it for sleeping. It helps enhance sleep. and whatnot. So in general, it's a very safe product. It consists of a variety of brown seaweed, basically, from Japan that I have. I took about 3 years of identifying each of the different seaweeds and testing them in the laboratory and in the clinic to find out which ones had the most activity in this regard, and put these together. And these fucoidins, they're called, these fucoidins go into the bone marrow and release these stem cells into your system and have a rejuvenative effect on your body. So, and that can be ordered online. Just go to the internet and put in Steemgevity, Stemgevity, and you can order it online. And you take generally about three capsules a day. Gives you about the optimum amount of material that you need for optimization of your stem cells. So either before or after you have stem cells, this is a very good product to take.